This is Diane Nesselhoff for Sharing the Dream in Guatemala. We're at the Real Dulce and we visited Casa Guatemala this afternoon. Casa Guatemala is an orphanage with about 140 children right now. It's actually a children's home. Sharing the Dream has been involved in Casa Guatemala for 27 years. But I wanted to show you today the clinic that a church in St. Joseph, Michigan, St. Luke's, has helped build, and the wonderful things that this church has given to Casa Guatemala. The video shows the extension of the clinic, which was really important for not only Casa Guatemala, but for 14 villages. So you'll get a little tour of the clinic. You'll talk to a nurse you'll hear from a nurse who's been there for on and off for 6 months. And you'll also hear about a health provider that we will be hiring with the money from St. Luke's for the Casa Guatemala and the 14 villages. You'll also see a little clip of the children dancing. So enjoy this video, and thank you, St. Luke's, for all you've done for the community at the Real Dulce. This is the addition to the clinic from the boys' house. You'll see it better. We're going to go over to the clinic in a little bit. Looks great, doesn't it?
Hello, my name is Michelle. I'm a nurse from Michigan, and here in the new edition of the clinic. The clinic will be getting a nurse assistant that will be here full time to coordinate all the care that we're doing, also the classes, all the education, because we have doctors coming in and out and nurses coming in and out like myself. And he will be working with the Centro de Salud here in Guatemala, which is a government-run medical care system, and to give the villagers here, who right now are usually not counted for their health needs. A lot of the babies aren't even registered with the state, or with the country. So it will be good for all of the villagers here to have a voice and be able to come here and get their health care needs met instead of having to go all the way to Fronteras, which is a huge problem and a huge reason why they don't get medical care. I just wanted to say thank you so much for helping us do the work here. It's made a huge impact in the community. The people are much healthier than even every year, get much healthier and have much more knowledge. So thank you so much for putting in your time and money to help us create this wonderful clinic where the villagers can come and get care.
Should we have a little tour of the clinic?
Yes. Okay. Well, this is the new addition. Right now we're using this, Dr. Barber will be coming. He comes from the States with a group of usually 6 residents that will come through and see all of the kids. So we'll set this all up with tables and chairs, and they'll go through in just a few hours, deworm all the kids, check them over, and do well child checks with them. And it's very nice to have this space to do that.
And that's from the village?
Those actually are the students here.
Okay.
And a lot of them, though, are from the village. So they come and do that.
And so this week, since it's the start of school, do you do what with the children?
That's what we'll do this Friday. Dr. Barber's coming, and what he will do is actually bringing the medicine to deworm all of them. So he'll do well child checks on every single kid here, which I believe is 240 or so right now. And they're coming from villages all over, so a lot of them really need the care, and their parents can't afford to get them it. So he will deworm them all, check them all over. If they have any further needs, the doctors will take care of that. He will also see villagers if they come during that time. They'll work them into the system, and they'll all get seen.
And so the new coordinator that's going to be here, the young man,
he will be coordinating, like, for example, I've been coordinating that when I'm here, getting all the charts ready, because all of them have records, so we can keep track of everything. So he'll be able to coordinate all that, work with closely with Dr. Barber to know when he's coming, what he needs, how we can facilitate all of that to happen so that it's smooth and everyone gets seen. So right now it's not a consistent person, like I'm not here all the time, so it'll be nice to have someone that's here all the time, knows exactly what's going on.
So because of the donation from St. Luke's in St. Joseph, this addition was added, and then the young man will be hired.
Yes, exactly. So thank you to them for doing that, because it's very important to have this this person, this consistent person. That's probably the biggest problem with the clinic, to not have consistency in the person that knows exactly what's going on. So that will be huge here to have that.
Okay, you can finish our tour.
Okay. This is the kitchen. We don't really use that much, just we have water in there and basically storing things right now. But eventually we'll be able to use this stuff more.
Is this where you use like more lab stuff, or is that a different
Well,
place?
that's the goal eventually, is to have a lab here. Right now we don't have any lab testing supplies, so eventually hopefully we'll be able to do at least minor testing, and because that would be helpful to do blood and urine and stool. This front room we use as a room for the sick kids. I just had a sick one in here, so it's a little. But during the day, if some of the kids, if they're sick, we'll put them in here just to have a break from school if they can't go home. And then we weigh and measure everyone in here. This is sort of our waiting room here. A lot of times I might see the patients out here too, because there's more light. So this is the exam room. The light's not on right now. I don't know if you can see. This is a very nice exam room.
So is there certain times of day you don't have electricity?
Most of the day we can have it if we want. It's not that much, so I usually don't use it unless I need it. We have nebulizers, so if we need to do nebulizer treatment, we need electricity, so I'll ask them. But this light, it doesn't give that much. It's actually, the sunlight's much better, so we'll usually use out there. But this is where we do the exams, and we have medicines and stuff in here too. And running water, which is great. And then this is our pharmacy, which is also very wonderful. We have quite a bit of medicine. Right now we're a little low on antibiotics, but usually we're pretty good with antibiotics. A lot of it's cough and cold stuff. It's primary care mostly, so it's stuff they really need, but they just don't have. That we all have the advantage of having cough and cold medicine or arthritis medicine so that we can do our jobs, but they don't. So it's very hard for them. They have hard work to do, so we can help them with that. And we have a little bit of milk right now too.
So what brought you to Casa Guatemala?
I always wanted to do a trip like this. So I found Casa Guatemala on the internet actually, and I liked that it was an orphanage, so you could work with the kids, because I think that's really important for teaching purposes, to really get to the kids first. And then to work with the villagers too is just really a great experience to learn so much about the culture and the kind of illnesses they have here. So I was supposed to only stay for 3 months when I got here, and I ended up staying 6, and now I'm back again. So I think it's a really valuable. The clinic adds a lot of value to the organization. So it's really nice to be able to work with them here, and to have help from you all there in Michigan.
This is the dock going to the clinic, and this is the new part that just they put in because the dock was sinking. And I'm walking towards, they got half of it done. And I'm walking towards the part that has to be done. So we'll be putting in some more money from St. Luke's, the church in Michigan, who the clinic has been a project of theirs to finish out the deck going there. As you can see, it's pretty dangerous. I'll take another video from the other angle. Here's the video from the other angle. You can see the part that needs to be repaired, so that'll be the next thing to do.
And they're just so cute. then there was sunshine.
Oh yeah. Adios.